Hello, my name is Yvonne Brooks. I'm a 100% disabled veteran, and I'm also an accredited claims agent with the Department of Veteran Affairs. I have a LLC called Veteran to Veteran Info. I also have a Facebook group called Veteran to Veteran Info, which I have almost 700,000 followers on there. In this group, we help each other get the benefits that we deserve. So please join my Veteran to Veteran Info group and also subscribe to this Veteran to Veteran Info YouTube channel as well. Today we're going to talk about a disability that a lot of veterans don't know about. It's called female sexual arousal disorder. This is a fairly new disability added to the VA claim system. Female sexual arousal disorder often happens due to military sexual trauma and other events. If you are experiencing symptoms from female sexual arousal disorder, some of the symptoms that are related to female sexual arousal disorder is low sex drive, also known as hyperactive sexual desire disorder, or low sex drive in women with FSD. Having a low sex drive means you have little or no ability to get aroused. And that can be a problem sometimes in marriages, that you seem to have female sexual arousal disorder. And they added this rating to the rating schedule in 2018. The change came because the VA wanted to ensure that male and female service members and veterans receive equal benefits for sexual function problems. Before, they only offered erectile dysfunction, and that was just for men. But now they also offer female sexual arousal disorder for females as well. If you have certain disabilities, you can have FSAD secondary to a service-connected disability. A lot of times, females that have depression or anxiety or been diagnosed with PTSD may develop symptoms of female sexual arousal disorder. If you take certain medications, you may have female sexual arousal disorder. If you take like hypertension medication, which can cause it. If you have diabetes, certain diseases, female sexual arousal disorder can be a secondary condition to certain diseases as well. Some of the things that are related to female sexual arousal disorder, some of the symptoms can be orgasmic disorder. Orgasmic disorder, women with orgasmic disorder have difficulty achieving orgasms even after experiencing intense genital sensations and having the desire to engage in sexual intercourse. Reduced blood flow to the clitoris is a common cause of orgasmic disorder, and that is a symptom of female sexual arousal disorder. You can also have sexual arousal problems. Your desire for sexual activity is normal, but you have arousal problems that make it challenging to become aroused through clitoris stimulation or remain aroused long enough for sexual intercourse. Or you may also experience sexual pain disorder. These symptoms of FSAD causes pain during sexual stimulation or during any type of vaginal contact. There's some other secondary conditions that can be related to FSD. If you have a muscular injury in your lower area, you may have FSAD due to that gyno issue that you may be experiencing. If you have, like I stated, the PTSD, depression, anxiety, if you, due to PTSD or anxiety, depression, you may use alcohol or substance abuse. Those things alcohol or substance abuse can also lead to female sexual arousal disorder. And if you are using alcohol and drugs due to your service-connected PTSD or MST, you can put in a claim for FSAD secondary to substance abuse due to your service-connected PTSD. You can have neurological conditions that can impact you and cause you to have FSAD. As stated, side effects from different types of medication can cause you to have female sexual arousal disorder. You could have heart conditions or blood vessel disease that can lead to you having FSAD. You can have sleep disorders or sexual abuse that can lead to that FSAD as well. In order to get service connected for FSD, you must establish a current diagnosis of FSAD. If you haven't talked to your physician about the different symptoms related to FSAD, you need to contact your doctor and explain to them that you didn't know that that was even a diagnosis. A lot of people, women, have been experiencing these symptoms for years, and they never knew that there was a name or medical term to identify their experiences. Now I'm letting you guys know that if you were in the military and you have certain disabilities that can have a secondary condition for FSAD, you need to put in a claim in for it. You need to discuss these issues with your primary care provider. You can also have your primary care provider, if they're a civilian doctor, to fill out the DBQ for FSAD, and you can submit that claim as a fully developed claim without having to go through the VA. If you don't have a private doctor, you can just put in a claim for FSAD. You're going to put that claim in on a VA form 21-526 Echo Zulu. And then you're going to put female sexual arousal disorder secondary to PTSD, or secondary to diabetes, or secondary to a medication that you take for a service-connected disability. And you can also get a nexus letter from your doctor. A nexus letter must contain 3 things. It must state that the doctor has reviewed your medical history, that the probability is 50% more likely than not that FSAD is secondary to your service-connected disability, and it must provide a medical rationale for their opinion in order for it to be an effective nexus letter. FSAD is not considered a mental disability, even though a mental disability can cause FSAD. You will still have to get a diagnosis from your primary care doctor or be given a CMP exam for a doctor to evaluate you and state that you have FSAD due to your service-connected disability. The best way to go about this is to get the diagnosis first from your primary care doctor, then put in a claim for FSAD, so you already have proof that you have discussed this issue with your primary care provider and you do have symptoms of female sexual arousal disorder. A lot of times women don't like to discuss these issues with their primary care doctor, but this is something that's very common among female veterans, that they suffer from female sexual arousal disorder, and this is nothing to be ashamed about. So if you think that you are experiencing these symptoms and that you are able to get compensation, they don't give you a rating for female sexual arousal disorder. What they give you is 0%, but they will service connect it and they will pay you a special monthly compensation. It's called an SMCK. Is what they're going to give you. What they are stating is that you have loss or use of a reproductive organ. That's what an SMCK is. And they will give you that rating due to the FSAD that you have due to your service condition. If it's due to a military sexual trauma, or if it's due to a medical condition that you have that is related to your service, your FSAD can be service connected as a secondary condition. So if any of you females are experiencing the symptom, please go to your doctor, explain your symptoms, and get the services that you should be able to get due to that condition that was caused by your military service. Please follow this YouTube channel for other updates on things that you can get that many people aren't aware about, because I'm a accredited claims agent. And so there's so many different disabilities that veterans aren't aware of that they are eligible for due to their service, that they should contact the VA and start getting their compensation for which they deserve. And also, Please hit the subscribe button to this Veteran to Veteran Info YouTube channels, because anytime that I add new videos to this channel, you'll be contacted to see the latest and greatest information that I'm offering to veterans. And I'm also offering different consultations for veterans individually. If you would like to have a consultation with me to help you increase your benefits, you can send an email to veteraninfo@gmail.com and contact me in order to get a personal one-on-one consultation to help you increase your benefits. And it's been a pleasure giving you this information and helping our veterans get the benefits that they deserve. You take care, and God bless, and stay tuned for more videos.